Eric, my brother, how are you?
I'm great, and you?
Thank you so much, bro. Everything is fine. Finally, brother. It's like I don't know when you left the center. When was your removal?
I left. My removal was end of September, and
2023, right?
yes,
Okay.
23 of September.
Okay.
Uh, After the removal, I stayed like 2 more weeks in Turkey, and then I get back to home. So
Wow.
now it's been 1 year and a half.
Okay. You see, brother, the
Uh,
time is flying, right? I mean, I asked you directly when you left the center because for me it's like also for like other patients it's like 6 months maybe, like not, but it's almost 1.5 year. So we are going to 2 years. So it's crazy. Wow.
yeah, time fly.
Wow. Time is flying, bro. Eric, just to remember again your case. So what was your starting height? What is your current height? How many centimeter you reached?
So my current height was 162.2. I gained 9.2 centimeter, I think.
Okay.
9.1 like that.
Uh-huh.
So I should be 171 and a half, I think. I don't know.
So I mean, it's
Yeah.
from 160, like the beginning of 160 to over 170. It's such a great height. Also for me, for my first like like before all my surgeries, just a dream, which I can dream sometimes. You know what I mean, and not all the time. So, but now
Yeah.
it's of course it's different. Of course, still not the tallest guy. Me too, by the way, but it makes me happy and I'm happy and that's the most important thing. But brother Eric, obviously, how do you feel, bro? Like, how is the feeling? What changed in your life? I mean, I have a lot of questions, but go ahead, please.
To be honest, everything's changed. I
Okay.
mean, I feel like more confidence, of course, because as you say, I'm not the tallest guy, but I don't feel the shortest anymore.
Okay.
When I go walking in the streets or just in public,
Mhm.
I don't feel like normal.
Mhm.
So that's the important for me. Not to be short, but it's okay to be average, normal height. And yeah, because before the surgery, I felt really depressed about the height. I felt, I know like some people don't really care that they are small, but for me, it was hard because in my country, Switzerland, most of the girls and men are tall. So my old height was not even the average of women in
Mhm.
my country. So it was hard, um, not only for the girls, but I mean, for me, to feel like respect or just to feel accepted or fit in the society. I mean, everywhere that's when I was not in my house, I was outside in the gym, everywhere. I always care about my height, so I couldn't really enjoy the life because it was always like pressure for me to always be like respect or just feel good in your body. So I used before the surgery to put some, like insole in my shoes. It was maybe 2, 3 centimeter, I don't know. But yeah, it was not good for my feet. I could have problem about this. So yeah, I decided to change my life, and hopefully I mean, I'm really like I'm still really I mean happy because for me it's a miracle. I mean, without this surgery, I don't know if I could accept my height, and it's life changing. I mean,
Okay. So what, like,
really.
yeah, go ahead, please.
So yeah, it's just. I mean, everything in life is hard to achieve, but once you achieve, for example, in my case, it was a hard process. It was maybe more than a lot of people here. It was 3 months and a half to gain 9 centimeter. So it was hard sometimes. Some days it was okay, but in the end, the success and all the work that I put during this hard month paid off. So I'm happy.
It's worth it, definitely. Yeah. I mean, your before after is it's amazing, bro. It's amazing. But how do you feel right now? I mean, if you go outside or when you go outside, so do you feel like confident or charismatic or I don't know, like can I know your feelings, bro? Because nine and a half or something like that centimeter is huge, you know. It's almost 4 inches what you gain. So how is your feeling, bro?
It's, for example, today I was walking in the street with my sister in the city, and I felt like a normal guy, like not tall but not short. And when you know that you're not the tallest one but also not the shortest one, in my case, I feel like more confidence and I feel like prettiest than before. I mean, for me, height make charisma. I mean, when you are short, it's hard to have charisma because I mean, people don't really see you. So
You are right, brother. That was I had the same problems. You are absolutely right. It doesn't matter what kind of car you drive or something like that. People don't see you. That's true. That's true.
yeah,
What about your
but
clothes, brother? Are you happy with your clothes? I mean, like your style, or did you change it, or?
yes, it's changed because before I used to buy my pants in like kids section because men was a little bit too large. I always bought in the past in kids, but now since the removal, I just go in men's section, and of course it's still the smallest size of pants, but now it's in men's section, and it fits perfectly. So it's good.
Wow, wow. I'm so happy. I'm so happy for you. Eric, my brother, how was your lengthening process? Just, I mean, if you remember, was it hard or you mentioned a little bit, but can you say something about it? I mean, do you choose the lawn method, right? The fixator on your femur? And yeah, how was it, bro?
To be honest, I thought it will be worst. Of course, the first surgery when you broke your legs and put fixators, it's hard because in the past I never broke something, so I didn't know this kind of pain. So it was hard the first week because I mean I was not able to walk normally, but it's normal, and I have some pain, and I couldn't sleep in the side, but this is okay. But day by day you get better because once you leave the hospital, you go in your center, and when I went to the center, it started to be better for me because first I removed the big bandage, because my leg was stuck. I mean, my leg couldn't breathe because it was a big bandage after the surgery. So that was great. And also, I mean, I had my room, so it was like a hotel, but everyone was kind, everyone was taking care of me. There was a gym, so that was cool because I could, even with broken legs, I could just take the lift and go for train my upper body because my legs were broken. But I have like physio session maybe almost every day, like 3 or 4 times a week. I had like everyday nurse visits. Yeah, it was morning and evening, and even if I needed, they could. I just texted them, and they could come in my room fast. If I had a question, I could always text you, and you answer really fast. So that was really nice. Also, I mean, it was good also to be in the center because I don't think I will be able to do this surgery if I get to my home, because of course you get taller, because you have fixators, but it's hard to change the bandage alone. I could have more infections. I couldn't do physio. I mean, of course, I could do physio, but I will be physio don't really know this surgery in my country, so they don't know which exercise to do. And that was good in the center because there was only like broken legs, so they really know which exercise to do while you are growing. And every time that I had physio session, I was really happy because when you finish the session, you get like a small message, and this is so good.
Wow. Okay.
And
Good
yeah,
feeling.
I was sad when I didn't have a physio session because I don't know, I had like some pain, some muscle pain. And so I used to have a massage gun that my mom bought me. So when I didn't have physio, I used in my room. But of course, it was not the same feeling as you are taking care with physio. So it was also good to be in the center because for the social parts or mental parts, I mean, you are not alone in your house doing the process while your siblings are like normal, and you can talk with patients. You can tell, yeah, like if you have a pain, if they had already, or just talking is good because for me it was a medicine actually, because talking while you are feeling pain helps me to just change my mind. And yeah, it was a good feeling.
Wow. Eric, I remember that we don't, thanks God, correct me if I'm wrong, we don't had any complication with you, right? I mean, no infection, no mechanical problems. I mean, it was really smooth journey. Of course, not easy, but I mean, nothing is easy for sure. So my question to you, why your case, thanks God, was without any complication? So what was the reason?
I don't know really, because I know people that have infection or some that don't have. I think it depends of every person. But of course, I was always following the instruction. I mean, you cannot lengthen more than, I don't know, like 4 times a day. And of course, if you don't listen to you or the physios or the doctor, of course you can have infection more easily because they know more than you. So for lengthening, I never push too much my body. I always listen to my body. I mean, even if I had to lengthen 4 times a day and I felt like a pain in my left leg or right leg, if I was not able to feel good, I just lengthen like 3 times a day and just texted to my physio to explain them. And then the next day, for example, I lengthen one more time because the last day I didn't lengthen. So I first thing I listen to this, to the medical team, the doctor, you, everyone. I always, we have a nutritionist. She like do a good plan of your food journey, like what you can eat, what is not recommended. So I always listen to them. Of course, sometimes I was a bit like cheating. I ordered like junk food maybe 2 times, but but most of the days I drink a lot of water. I eat healthy foods, and yeah, I did like a lot of exercise before and after the physio sessions. When I have something or I felt something that was weird in my leg, I always tell to the nurse and explain them. I take everyday medicine for the body. Yeah, I think if you do all that I say every day, you should get good. I mean, if you just listen to people that know more than you and you are just patient, I think you have less chance of getting infection in my case.
Exactly. That's exactly true because I remember also you was taking care of hygienic, by the way, Eric. And I mean, unfortunately, the problem is, of course, complication can happen also suddenly, mechanical fault, something like that. But with the lawn method is the most common complication infection because patient have open wounds. Of course, it's not a secret. But as you said, I mean, if you are be careful, pay attention for your nutrition. The most important thing, listen. And of course, I mean, we can really reduce the risk. So, and you was one of the patient who was really listen and follow every instructions. I should say that. Yeah, that's also the reason why we don't had any complication and everything was exactly really, really, like smooth and quick also. So my question to you now is, people wanna know that because I heard about Eric had complication and yeah, he's not posting because he cannot walk. Live life tallest patient can never walk again and something like that. So brother, now you are here and it's like 1.5 year. I want to ask you, how do you feel right now? Can you walk? Can you run? Do you have any restrictions or any sign of that you did the lengthening and yeah, I cannot do this as before or anything? Can you explain a little bit about that because it's an important topic.
I remember when I get back to home after removal, I was in recovery process, so I used to walk the month, first weeks with not the walker, but with I can't remember the word, but it's like crutches. Thank you. So it was a support for me to walk because it was hard once I removed to walk, I mean, correctly. But I started to go to the physio in my country to gain again the flexibility, mobility. And I used to go slowly, step by step in the gym. I was not only training legs, but also the upper body, but of course more the legs to gain muscle because once I removed, I didn't have too much muscle, so it was hard to walk or just to don't be tired when you walk. So the first month, I mean, maybe the first months until December was hard because of course I didn't have any more fixators. I didn't have infection, gratefully, but my walking was not really good because I don't know, it's normal because you lengthen the legs. I gain 9 centimeters. It's normal. I just let time to my body to understand that I got taller and I broke my legs. And step by step, I think start of January, February, before the holidays, I started to feel better. I mean, I could walk a lot, maybe 5K step a day. So it was really good in the beginning, without any more crutches. And also, once I removed the crutches, I was walking like penguin, like right leg. I fixed that just going to the gym, do the stretching exercise. That's the physio in the center send me. And yeah, because in my case I had like lordosis, so my back was like that. So it was hard also to walk like straight because of that. But I fixed that, and after it was really smooth. I mean, I could walk more every day. Now I can walk like before the surgery. Yeah, I know that in this December, I was in vacation in Universal Studio in Orlando, and it's big attraction park. And I think I watched in my phone. We walked like 20K step, like 10 kilometer.
Wow.
Yes. Oh, and I didn't have pain in my leg. I feel like normal. I thought the next day I'll have like stiffness in my legs, but I just have like pain in my tibias. But I just take ibuprofen, and then the pain was gone, and I could like be normal again. So I mean, my walk now is same as before. I can run also now. Um, yes, I don't know if I can run a lot, but I can run. And for that, I just train legs in the gym and just try to run in the treadmill when I go doing cardio in the gym. And yes, since 2 months now, I can do a new position that I couldn't do before. It's like, how can I explain? When you are not sit, I mean, when you just try to get something that is lower than you have to like cross your knee. I don't know if it makes sense.
Yeah. I understand what you mean. And you
Yeah,
can do that now.
yeah, I can do it because before I was scared. I don't know to broke my bone or just fall. So I did it, and I was like, oh, so I can do it. I'm not gonna fall anymore. I'm not scared. So I was really happy, and I mean, I can jump. I can do everything since the before the surgery. So for me, it's amazing because I never could expect that I will be taller and even more like be normal again.
Oh, hey, I'm so happy right now, Eric. You make me really happy right now because, I mean, people is really talking a lot of negative stuff, wrong informations. You will be never the same. And, like lawn method is dangerous and this, and I'm telling always to the people, guys, not the limb lengthening surgery, to be honest, is the problem. Always the patient, unfortunately, because I mean, if you are a good patient, you will have a good journey. You know what I mean? If you are a hard patient, you will have a hard journey. So, I mean, it's unfortunately, this is a fact. So, and you are definitely you are a good person and you was a good patient, by the way. And yeah, that's the reason why you are also feel good. I mean, once even you go back, you able you was always like active and no lazy and something like that. This is really really important, bro, especially for the limb lengthening surgery. But I'm really really happy that you can do everything. By the way, can you feel the nails or nothing?
No, I don't feel it. I mean, I think when I removed, hopefully this year, I will feel like 100% because once sometimes when I try to run, I don't feel the nail, but I feel that I'm not 100%.
Yeah, exactly. Because the nail is holding your bone flexibility. That's the reason why.
Yes, but I don't feel it. It's like a bone for me.
Great. So when you did the surgery and go back to Swiss, did you visit a doctor to check your legs?
Yes, so I have a doctor that follow me since I'm younger, and he's from my family, so that's great because he know my situation that I did height surgery. So yeah, he just checked my scars. He just checked the hole that I had. It's a small hole in my case in the legs. I'm lucky, and yeah, I just sent also to him the radios that I do every 2 3 months, and yeah, he say nothing of wrong. I mean, he say that Dr. Halil did a great job, that my bone is really good. Also, I'm younger, so it's of course it's easier to have a faster recovery and also to gain again the bone healing. So yeah, it's I don't have negative things about this surgery, to be honest.
Bro, great. By the way, I forget to ask you something. What was the reaction of your friends, bro? Of your, like people who knows you and family, except of course your mom, Katie. I mean, of course, she was always with you. But what was the reaction of other people's?
Bro, it's so weird because I have like it's not my real sister, but it's like my stepsister. So before my surgery, she was like one head more than me, like 175, I think. And once I get home and she saw me, I was like same eye level. I mean, almost same height. And for me and for her, it was weird because she always saw me like that, and now she saw me like this. It was like a weird feeling because of course she was not get used to my new heights. But what is amazing, it's that once people see you again after the surgery, of course they get shocked. But then I asked to my friend, do you remember my old height? And they say no, because for me, you was always this height. I mean they forgot the height. Yeah, I mean everyone saw it that I grow. They was like, whoa, what happened? You are flying. Yeah, I mean some people don't say things in my family that I grow because I mean they don't understand what I did. or just they are shy to talk about this, so they prefer to don't talk about that. But most of people saw that I grow because it's like, of course, I'm not tall, but I mean, it's a great height changing. Yeah, it's crazy. Even like in my home now, you know, before with 162, I always, when I wash the clothes or just put the dishes in place, I used to be in my toes to just take something or put something, and now I don't need it anymore. So it's like I'm wearing shoes in my house, but not I'm not. So
Even
it's really,
this feeling is worth it, man. It's amazing.
yes.
I know that the limb lengthening was also your biggest dream, was also my biggest dream, and that's the reason why I totally understand you, bro. Eric, what do you think about the topic? I mean, there's some people who's really talking negative around the internet about limb lengthening, also about Livelifetaller, by the way. But anyway, so because like there's a lot of people who want to make his dream come true, as you and me. But also at the same time, all the negative comments, you can never walk again, you will be get crippled. I don't know, you will lose your legs, infections, lawn method is a dangerous and so. What you can say as a former patient who had also experience in this area, So what you can say about it, bro?
Well, I mean, for me, I was also scared before I know you and like this surgery. I was scared because I don't know, like you broke your legs. It's like something incredible because I was like, okay, you broke your legs, but how you can actually grow, how you can be not disabled, how you can be normal again. So I got a lot of these questions in my mind. But day by day with my mother, I get more information about this surgery until I found you. So when I found you, I could ask any question and you answer me. So it was really good because I had like some question, that you are not feeling. I mean, you are scared of question. It's normal because it's not any surgery. It's like something, how can I say, like something crazy, if I can say. But of course, it's normal to be scared once you don't know this surgery. But what you should get scared, it's which doctor you're gonna do and which company. Because of course, if I did this surgery, I don't know, it's an example in India, for example, I will be more scared because I don't know if they have a center. I don't know many patients that did this surgery in India. And yeah, I mean, it's normal that people are scared of this surgery because it's not like a common surgery. It's not like, for example, nose surgery, hair surgery. It's like something new, if I can say, even if it's not new. It was an old surgery, but I think every every year maybe it's gonna be like surgery one day. So hopefully, but once you get information. Once you see, for example, in YouTube, the patients talking about the process, you gain confidence because you know that you're not alone. There is some people that did it, even you did it. So you know the process, how it works. So this is really great also because I don't know, to be honest, if I will do the surgery if not someone of the team where I stay did the surgery. So what was nice with you, it's that you did the surgery, so you understand the patient, you understand like how it works, and that was really good for me because it was like confidence. I feel like, okay, so if Sedat did it even 3 times, I can do it. And I felt like less lonely about this. And which is good also is that you can visit the when I was in Turkey doing my legs lengthening, I saw some patients from country that were just visiting us just to ask some question about how is the process, everything. So that's great because you don't have to do the surgery to talk to patient. I mean, you can talk to patients even before the surgery. So you can talk in real life because some people think, yeah, it's social media, so of course it's fake, or maybe Livelifetaller say to people to say that, say this sentence. I mean, like, say, for example, someone is in a bad situation in the center, and I don't know, like the cameraman say, okay, so we are going to record a video, so say to people that you are good. But actually, it's not the case. I mean, even when I was not good, I say in the videos sometimes that I was feeling pain or something like that. So, of course, social media, what you see, it's not every time true, but in this case, I mean, it's not like something that's, I don't know, like, what is the goal to shame a company for doing this kind of surgery, or just shaming the you or some nurses, some physio, I don't know, because I don't know, like, of course, complication can happen, but most of the time you are saying the truth. And yeah, it's, I mean, every surgery is gets can have complication. It's not only height surgery, so it's normal sometimes to have complication or infection, for example. But yeah, I mean, you don't have actually to believe to everything that you saw. But in my case, I just believe it, and now I did the surgery and I feel great. So yeah,
Also, thank you so much, Eric, for your nice words. Also, which is really important to me was that your mom, because mom is holy, so like always, and your mom was also trusting in us. And I remember Kathy, she came to me and say, "Hey, look at that. Now my son is under your care, so I trust you guys. So you have my son now." And I told her, "Don't worry, Kathy, your son is our son." So don't be worried about it. If anything happen, you can text me anytime. And she was so happy. And by the way, pass my regards to your wonderful mom, bro. Please, pass my regards. She's amazing. She's really amazing.
thank you.
You're welcome, brother. So, and yeah, unfortunately, bro, there's people who needs attention, or maybe who needs, yeah, like I don't know, who needs job, or who have to work and make this topic to his main job, or I don't know what. But anyway, so I can also say, correct me if I'm wrong, I never seen from our patient that anyone is disabled or crippled or lose his legs. I never heard and seen that. I don't know, you maybe also, because you are also being touched maybe with patients, or you was in the WhatsApp group as well. Of course, as you said, complication can happen. And also, Eric, that the most important thing I'm always mentioning in all my Zoom calls with the patients. So for me, for example, if I want to do something, for example, if I want to go to a restaurant, the first thing is that I'm checking the place with my phone, or if I want to go to a hotel, before I book the hotel, I will check. So, and
Yeah,
if you want to do, or if you want to undergo such a surgeries, of course, I want to check, hey, is this place really the right place? So, and how I can know that. I have to see before and after picture of patients. I have to see really the places doing surgery. I have to see patient stories, and such information will give me confidence to do it. You know what I mean? As you said, which I really appreciated. But unfortunately, still today, you cannot really see any before after any patient story. Even if you see a before after, they cover the face so brutally that you don't know if the same patient or not. And in our generation, the AI and everything is there, bro. So, and of course, such a thing is yeah, really dangerous. And then you cannot call the place or doctor as the good doctor or the best doctor in the world, because he's not able to show any one of his cases to you. And yeah, this surgery is really important, because we know that complication can happen, but we also are ready for all the complication what can happen. And Eric, also our surgery number is different. We have a lot of cases, of course, also a lot of different peoples and international peoples, a lot of, and also different number of complication for sure. Well, brother, what you can recommend to the patients who want to undergo the limb lengthening surgery?
many things.
Oh,
I
wow.
mean, I mean, in my case, before doing the surgery, I trained 9 months before coming to Turkey,
Oh, okay.
uh, stretching my legs
Uh-huh.
almost every day, like just 5-10 minutes a day. It was enough. Some exercise just to be more ready for the surgery, or to the process in the physio gets easier, I started to eat. I was already eating healthy, but more healthy. How can I say? Your mental has to be ready because even in my case, it was like I prepared myself 9 months before coming. So I knew that even with a good life, I mean a healthy life, it will not be easier sometimes. So I just prepare myself, okay, I will do this for my body to feel better in my life. Of course, it's 90 days, sometimes hard, sometimes not. So I put this in my mind, and yeah, I just was positive. Also, what you can do also is taking some supplements before the surgery. I mean, I take like some supplements to for my bones, just to maybe to feel them stronger. Yeah, I think if you have a healthy life, just try to be ready for the process because it will not be easier every day. Yeah, I think it's this.
Great, great, great. Yeah, I mean, you're right. So, I mean, healthy lifestyle, healthy life. So that's it. You know what I mean? So, brother, thank you so much, Eric. And I also want to ask you why you are doing the video with me, bro. Why you are okay with that? I mean, why you are helping Live Life Taller? And yeah, why?
Well, because I think you guys saved me. So for me, it's a pleasure to always support you guys. For example, in my case, I don't stop posting video in Instagram because I was feeling bad or infection. It was not this. It was just that my videos were always almost the same. So I want to find a new content. I don't know still which one, but to answer more the question, it was just because yeah, you always was there for me, everyone. So I have to do the same. And I mean, if I'm good now, why I will have to hide it to people's? So yeah, that's just this.
Appreciate it, brother. So in like we can say you are a man with character, and you know what appreciate it is. So I thank you so much, my brother. Thank you so so much. By the way, are you happy right now with your height or
Yes. Yeah, I'm
not?
happy. I'm happy.
Okay, great. But maybe tibia or
Oh, I don't know. I don't think so, but maybe one day. I don't know.
of course it was joke, brother. The most important thing is that you should be happy. Also, I told you, I told you, you should be enjoy first of all your height. Maybe you will be happy, maybe not, of course. But anyway, we have solutions. But I think you have a great height. If not, you can change anytime. You know that. As long as you're healthy and as long as everything fine. All right, my brother. Thank you so much. By the way, Eric, when do you come for nail removal?
Maybe this year.
Okay.
Uh, s- I think in summer maybe.
Okay, okay. I mean, yeah, you don't have any problem with the nail, but to just feel 100%, I would really recommend to take it out. And you can take
Yes.
it with you and just a memory, you know? All right, my brother, thank you so much also for the video. By the way, Eric, as you know, once since you left, we never text to you, bro. Please make a video special for us. Of course, I mean, if you have videos, will be great because I was never that guy. Also, I never teach my team in that way to disturb people's, because everybody has his own life and stress life, and so and just like be to think about our business. But right now we are in a point also I want to change the content a little bit of Live Life Toler as well. I want to be more focused on patient who left, who did the surgery, because I mean, once you make your own research, you still cannot say any patient story, but we want to make the whole process as much as transparent as we can. And in that point, I want to say again, thank you so much, my brother. I really appreciate it. Thank you for you guys that you makes us also to makes us to give us the opportunity. I'm sorry, and because of you guys, we can also post our job. Because Eric, I told you also to Kati, we are proud to post our job First of all, because we also don't hide anything. We know that we are doing right job, like how to put the nail in the bone, how to put the fixator, how to you like cared about the patient, the medication management. That's the reason why we don't have any reason to hide something, and we post everything in a transparent way. But also, of course, thank you also for all our patient, also for you that we have the opportunity to can post also our job, because also patient have to be agree. Yeah, bro. Thank you so much, Eric. And I will be really happy if you can send us some videos like jumping, running, and doesn't matter what you are doing right now. So I will be really happy to add here as
Yes,
well. And guys, follow Eric's Instagram, please. We also write your
I
Instagram
will.
here. Yeah, yeah.
I will start, I will start doing a new video.
Awesome. I really appreciate it. Thank you so much, my brother. Thank you for the great video.
Thank you.
Yeah. Pass my regards to Kati and to your whole family.
Yes, for you also.
Thank you, my brother. Bye bye, bro. Bye bye.